Hi there, this is Carrie McQuiggan, and this will be a short presentation on obsessive compulsive disorder, also called OCD. The disorder is characterized by involuntary recurring obsessive thoughts and then repetitive compulsive behaviors that result from the anxious thoughts. There are a few common themes that people suffering from OCD obsess about to an extreme level. The first example is germs and cleanliness. People with OCD often have irrational fears of germs and contamination. They might be unable to use public bathrooms due to this fear, or may not be able to shake hands with others for fear of coming in contact with the germs on their hands. They may not be able to eat at a restaurant because someone else has prepared the food. They don't know how clean the silverware is. They might perform compulsive behaviors like washing their hands 3 times in a row or excessive teeth brushing, which can actually damage their gums. The second example is intrusive and irrational thoughts. People with OCD start thinking about something and then they can't stop thinking about it. Maybe these thoughts interrupt their normal day-to-day routine. Sometimes these obsessive thoughts are aggressive, violent, or sexual in nature. Sometimes a person might become obsessed with certain religious beliefs or in make-believe things like aliens or ghosts. They may become convinced that their spouse is cheating on them. They may get fixated on a celebrity crush to an extreme. The next example is symmetry and order. Everything must be done just right. For example, evenly in a certain order or in pairs. Like if you open the driver's side window, you have to open the passenger side window to the same height. Or all the canned food labels in your pantry must be facing a certain way. Or maybe they organize their clothes in a certain way in their closet or books on a bookshelf in a certain way. Everyone develops systems for organization, but people suffering from OCD are consumed by these obsessions and become physically distraught or sick if their organization is disturbed somehow. The next example is rituals. OCD sufferers perform many time-consuming rituals throughout their day, such as checking the stove several times to make sure it's turned off, flicking light switches on and off several times, turning doorknobs in a certain way, clockwise or counterclockwise, pouring your cereal a certain way, unloading the dishwasher a certain ritualistic way. One of the last examples I'm presenting is repetition and counting. Some of these behaviors I've already mentioned, like washing your hands 3 times in a row or flicking the lights on and off. Those are examples of repetition and counting already. OCD sufferers might also be consumed by counting, like while brushing their teeth, or counting the number of steps you take from the front door to the car, taking stairs 2 at a time, adding 2 pieces of laundry to the washing machine 2 at a time, etc. It's believed that anywhere from 1 to 4% of children are affected by obsessive compulsive disorder. Although there's not one cause that scientists or doctors can point to for the individual cases of OCD, there are a few things that are widely accepted that contribute to the disorder. Environmental factors are suspected to be a root cause for the neurological disorder. Any kind of trauma that a child suffers might manifest in the development of obsessive or anxious thoughts. And although they can't explain why this starts happening, certainly there's a common link in people with OCD that there's usually a problem with regulating serotonin in the brain. Unlike any other neurological disorder, OCD is not predisposed to women or men. It remains about 50-50. And there is a hereditary component to OCD. Children whose parents have been diagnosed with OCD are 4 times more likely to develop the disease themselves. The treatment for OCD involves anti-anxiety medicine, antidepressants, and cognitive behavioral therapy. It's noted that any type of medication usually does have adverse side effects, though. My mom is actually a therapist who treats patients with OCD, and she swears that healthy lifestyle changes such as diet and exercise also have a positive effect on the symptoms of OCD as well. Roughly 40 to 80% of adult OCD cases were diagnosed as a child. Many times, people suffering from OCD also suffer from other emotional and neurological disorders such as anxiety, depression, ADHD, Tourette syndrome, which is when you develop an uncontrollable tic like winking one eye or tensing your body, um, eating disorders because you become obsessed, and body dysmorphic disorder, which is when you think that um, your body looks a certain way, but really it doesn't. Um, Obsessive compulsive disorder wreaks havoc on all aspects of your life. Socially, people suffering from the disorder avoid others so they don't reveal their compulsive behaviors. It's difficult for them to maintain friendships when their rituals and routine takes up hours of their day. Especially children are subjected to bullying and embarrassment. They may avoid certain social settings to avoid germs or exposing themselves to crowds of people. Emotionally, OCD sufferers have low self-esteem. They're consumed by their anxious and irrational thoughts, worries, fears, and negative self-talk. We've already discussed the behavior issues that they face with all their routines throughout the day. And academically, they may suffer from having to turn things in late. They may never be able to get their assignments to the perfect standard that they create in their heads. They may miss directions and instruction when they're consumed by their disruptive thoughts. Students with OCD may be able to qualify for special education services under the IDEA exception Other Health Impairment if their symptoms are worse than what the general education teacher is able to accommodate for. Teachers should have empathy for students with OCD. Every case manifests itself differently, and there is a wide range for the severity of the symptoms. Some students may have OCD, but they might not qualify for special education services. It's important for the teacher to communicate with the IDT team and be sensitive to issues such as bullying. Do they have friends with to sit with at lunch? Are there any classes that trigger symptoms worse than others, etc.? Next, it's important to stay in constant contact with the parents and professional resources available at the school, like the guidance counselor, the school psychologist, an occupational therapist if needed, the school nurse if there are medications involved. Teachers can aid students with OCD by chunking assignments into small, more manageable sections if necessary. They can set up predetermined cues or cue words with the students and then keep an eye out for moments when the student might be getting stuck and needs help snapping out of it without drawing attention to the rest of class. And of course, the teacher should use proximity so they can keep an eye on the student and monitor the behaviors, um, and if the behaviors are interfering with that student's ability to learn or to demonstrate proficiency in an assessment. Lastly, I pulled two websites that offer some information for parents and families of students with OCD. They might be helpful resources for how to gently handle anxious and irrational thoughts which cause them to act out with the compulsive behaviors. And I also put a link that has a list of apps available for people with OCD. You can track certain behaviors. Some of the apps provide relaxation coaching to address the anxious behaviors, and some of them provide follow-up activities for cognitive behavioral therapy sessions, which they might be going to once a week or so. At this time, for your informal formative assessment of this presentation, I would like for you to pretend you are suffering from obsessive compulsive disorder for a minute, and I would like you to draw an Instagram post with something you might post in a day. It could be a picture that sheds a light on your symptoms. It could be a way that you're trying to manage your symptoms. It could demonstrate a way that you're suffering either at home or at school. It could be a post about your support team who are helping you. It could be artwork that you would draw as an OCD sufferer. It could be an illustration of your brain, the way it works while suffering from OCD. Make sure to include the relevant hashtags so others can search for your post. Thank you.